Hello, my name is Dalila Tapia Padilla, and my presentation will be on morphine. I'll be introducing what morphine is, its effects on the body, as well as addiction and overdose. Starting with introducing what morphine is a non-synthetic narcotic with a high potential for abuse, and it is derived from opium. So to break this down a little, non-synthetic means that a substance is derived from a natural source like plants or minerals, and opium is a highly addictive narcotic that is extracted from the poppy plant, also known as Papaver somniferum, and so that's shown here on this slide. This poppy is also the key source for many narcotics, including morphine, codeine, and heroin. Continuing, morphine is used to relieve physical pain, decrease hunger, and inhibit the cough reflex. Its effects also influence euphoria, and chronic use of morphine results in tolerance, along with physical and psychological dependence. Also, some interesting facts about morphine. Some common street names are Morph, Morpho, First Line, or God's Drug. Under the Controlled Substances Act, morphine is a Schedule II narcotic. And lastly, other drugs that cause similar effects to morphine are fentanyl, oxycodone, and methadone. Continuing on to its effects on the body, morphine is absorbed from the gastrointestinal tract, and its effects begin about 60 minutes after administration. It is widely distributed to tissues including the liver, kidneys, intestine, lungs, and skeletal muscles, and it can also cross the blood-brain barrier. When morphine makes its way through the body, it attaches to multiple receptors within the central nervous system and the peripheral nervous system, which in turn reduces nociceptive transmission. Nociceptive transmission is the process by which our nervous system converts and sends signals about harmful stimuli such as a cut or a burn, meaning that pain is reduced in general throughout the body. Moving on to addiction. When an individual takes opioids such as morphine regularly, their body makes less endorphins each time they take the drug, which is also called tolerance. As an individual builds their tolerance to morphine, they might want to raise their doses and eventually start to crave the opioid. This can begin the cycle of addiction. Opioids are most addictive when they're used in other ways than how they're prescribed, such as crushing a pill to snort it or injecting the drug. Research suggests that taking opioid medication for more than 5 days can increase the chance of year-long addiction. Other risk factors include psychological, genetic, and environmental factors such as family history, stress such as unemployment, depression, or history of physical or sexual abuse. In order to prevent addiction, it's important to work with your healthcare provider to take the lowest dose possible for the shortest time needed. Along with storing these medications properly and making sure to protect those around you by not sharing your medication or taking others' medication. This is all important to prevent addiction. Now I will be discussing overdose. Overdose, also known as OD or ODing, happens when a toxic amount of a drug or combination of drugs overwhelms the body. This happens because opioids fit into specific receptors that also affect an individual's ability to breathe. As the person's breathing decreases, the oxygen isn't reaching their vital organs, which can cause unconsciousness, coma, and even death. When someone is overdosing, their lips and fingers turn blue due to the low levels of oxygen in their blood because of their decreased breathing. As mentioned before, their breathing slows, lowering their blood pressure and slowing their pulse rate. Lastly, the National Institute on Drug Abuse gives 5 clear steps in case you find yourself in a situation where someone could be overdosing. The first step is to call 911 immediately. The second step is to administer naloxone if it's available. This is most commonly known as Narcan spray, shown here in these pictures. The third step is to try to keep the individual awake and breathing while also administering rescue breaths if needed. Step 4 is to lay them on their side in order to prevent choking, and the last step is to stay with the person until emergency assistance arrives. Thank you for listening to my presentation. I urge everyone to carry around Narcan nasal spray. You can find it at most pharmacy stores and also order it online, specifically through the Narcan website, or Amazon also sells it online. Thank you.